Okay, so let's try this again.
Welcome, everyone. And if you want, I can share if that doesn't work.
All
Yep,
right.
that works.
Okay.
Perfect.
Okay. We're going to go ahead and get started then. Welcome, everyone. You are all invited to introduce yourself in the chat this morning. Getting ready to say good afternoon for those familiar faces in our audience. Hello again and welcome back. For our new faces, which we have many.
I don't want us to be coming in to cover.
Okay, thank you. For those new faces, welcome. My name is Kendall Lee. I am the program administrator of the Maryland Emergency Preparedness Network. The EPN is an emergency preparedness communications network operated by the Maryland National Capital Home Care Association, otherwise known as MNCA, in partnership with the Maryland Office of Preparedness and Response, often referred to as OP&R, within our state's health department. And we provide emergency preparedness education, training, and resources to home and community-based healthcare providers, patients, and their caregivers. I would like to extend my gratitude to Executive Director Caitlin Hauk of MNCA, who's with us on the call today, offering her support, and the staff at OP&R for their ongoing support. Your invaluable partnership makes our work here possible, so we thank you. I'm so excited to introduce today's guest, but before I do so, let's briefly cover a few housekeeping items. For the recording, today's webinar will be recorded. You can expect to receive the link to the recording following today's event. Additionally, it will be made publicly available both on our website and our YouTube channel. For the audio and camera portion of today's presentation, you will have complete control over your microphone and camera settings. So while we kindly request that participants remain muted during speaker presentations, we welcome you to unmute during the Q&A portions of today's event. Additionally, you're warmly invited to activate your camera so that we can connect with you today, but it is not required. For the Q&A portion of today's presentation, we encourage questions. However, given that this is a recorded event, we kindly request that you do not share personal cases or identifying information during today's discussion. If you have case-specific questions, we are more than happy to provide the speaker's contact information at the end of today's presentation, and they will help best direct you to the appropriate resources to meet your needs. And now I'm ready to introduce today's topic and our incredible speaker. So now that we've covered a few housekeeping items, let's dive into today's topic. Aging. It is a universal experience that we all share, whether that's with ourselves or with our loved ones. And navigating this journey comes with important decisions, and having access to the right resources can make all the difference. And that's where Maryland Access Point comes in. As a statewide initiative through the Maryland Department of Aging, MAP serves as a trusted one-stop shop for aging and disability resources, ensuring that individuals and caregivers don't have to navigate their journey alone. So I'm so excited to introduce our speaker from MAP today. We are so fortunate to have Renee Stainrod with us today to guide us through the conversation around aging. Renee brings over a decade of experience in community engagement and public relations, supporting youth, families, and marginalized communities. As the No Wrong Door MAP manager, she works to ensure coordinated, person-centered services are available for older adults, those living with disabilities, caregivers, veterans, and families. So Renee, thank you so much for being with us today. It is such a joy, and you can take it away.
Thank you so much for the invitation to be here to present information on Maryland Access Point program. And I'm going to get started right now. So again, my name is Renee Stainrod. I am the very new Maryland Access Point manager for the Department of Aging. So again, for the Department of Aging, our vision is to transform institutions, systems, and norms so older adults lead lives that are healthy, financially secure, socially connected, and purposeful for the purpose of, again, living that 100-year lifespan. So speaking of 100-year lifespan, that's right. Marylanders like myself, like you all, are living longer. So it's estimated by the year 2040, we will have over 26.5% of Marylanders who are part of that aging population.
Renee, your slides aren't advancing. I'm sorry. I didn't mean to interrupt.
Okay, I'm sorry about that. Let's try it again. All right, do you all see my slides?
We do.
All right. So again, by the year 2040, it is estimated that over 26.5% of Maryland's population will be a part of that aging population. So in an effort to prepare Maryland for 2040, the Department of Aging is leading efforts through what we call LRM, Longevity Maryland. By connecting Marylanders of all ages with coordinated services that span sectors, governments, and organizations, MAP will play an important role in Longevity Ready Maryland. Its key resource in the implementation of several Longevity Ready Maryland strategies include strengthening Maryland's ongoing commitment to family caregivers, improving access to affordable, accessible housing options that support aging in place, and streamlining access to public benefits and services, improving equitable access to holistic health care that addresses physical, behavioral, emotional, and cognitive health. So what is MAP? So Maryland Access Point, again, is a statewide program through the Department of Aging that connects individuals through essential resources, services, and supports. We are that one-stop shop for older adults, individuals living with disabilities, and their caregivers. MAP plays a crucial role in navigating long-term care options. So realistically, MAP simplifies the process associated with accessing supports and services to help ensure that people get the right help at the right time. MAP aims to reduce that frustration that sometimes older adults living with disabilities and their caregivers can experience when trying to navigate the wide array of services. So everyone absolutely has felt frustrated getting shifted one phone call to a next, trying to access services. So MAP really reduces those frustrations by allowing that one-stop shop. When you call in, you can really have that personalized experience to get the services and supports that you need. So what MAP does and does not do. So for MAP, it is about getting access to information, planning long-term care and supports, getting connected to available resources, and education about personal and community resources. MAP is not for crisis intervention. It doesn't expedite eligibility and enrollment. So if you call and you're saying, I need service today, unfortunately, that is not what MAP does. MAP does not provide case management administration, although we can help in providing access to case management services throughout the community. Core services. So MAP has several core services, including information assistance, level 1 screens, options counseling, and MFP options. So in terms of information and assistance, we do outreach and education. We do provide referrals and application assistance. We also do level 1 screens, which is the preliminary evaluation of risk of institutionalization. So folks coming into a MAP office or calling in for MAP services, we're able to do level 1 screens to assess what your needs are and how we can best connect you to services. It's also used to evaluate and connect to waiver options and services. We also provide person-centered counseling, planning, and supports with certified staff to help individuals create that plan for aging. And for MFP, Money Follows the Person options, we do provide counseling as well as for nursing facility programs and education for those who wish to transition out of nursing facilities. And again, all those options, all those supports are available through our MAP services. So going back to that level 1 screen, again, it is used to gather in-depth information as part of the MAP options counseling process to help connect individuals to services and support that meets their needs holistically. As a result, MAP staff can add individuals to that community options waiver registry. We can also work with individuals to develop long-term care goals, as well as make referrals to a wide variety of programs and services to support individual needs, as well as provide application assistance and support. And that's a very crucial and critical part of the MAP supports, being able to assist those who really need assistance in completing their applications properly. So in terms of the community options waiver registry, when folks are able to access the community options waiver, services included are assisted living, medical daycare, family training, case management, senior care plus, dietitian and nutritional services, as well as behavioral consultations. As folks wait for an opportunity to access that registry, but our Marylanders can still access community first choice options, which include, again, personal assistance, support planning, nurse monitoring, consumer training, assistive technology, and again, a wide array of options and supports available to our aging Maryland population. Some of the programs available in conjunction with MAP, and you access these supports through MAP. Those include dementia screening and navigation. So for that program particularly, it is an 8-question assessment to determine if cognitive concerns are present and if additional screens are needed and necessary to aid in the support of a client. MAP sites are currently using this tool to assist clients and their needs. So this is the current tool that we're using at all of our MAP sites. National Family Caregiver Supports. So this program offers resources and supports for caregivers needing respite and other supports while helping to care for a family member. Very support. I think burnout is very important. Burnout actually really does happen. And how do we support our caregivers who give so much of themselves? So this is a really great program that allows our caregivers to get the respite that they need. Long-term care ombudsman program. So our ombudsman program offers education and advocacy for those caregivers and those in skilled nursing facilities as well as assisted living facilities. So those who need advocacy or really just have questions about how do I move forward, our ombudsman program is great. We actually have a brand new ombudsman that came to the Department of Aging. Carrie is amazing. She loves the work that she does and is really here to be a support for Marylanders who have questions, concerns, and need that advocacy. State Health Insurance Assistant Program, also known as SHIP, offers counseling to Marylanders needing information and supports regarding Medicaid as well as Medicare programs. Our SHIP manager, Julia, is amazing, keeps up to date with information about the SHIP programs, about Medicaid, Medicare programming to be able to assist Marylanders who need this help. I think navigating these organizations, navigating these tools can sometimes be very difficult. So utilizing SHIP as a way to get the assistance that our Marylanders need is very important. Durable medical equipment reuse. So those who really need medical equipment such as wheelchairs, canes, crutches, walkers, rollers, this program assists in getting those resources to the vulnerable populations that really need them. And our senior call check program allows seniors to receive daily call checks to aid in their daily living, to make sure that if there is a fall or something catastrophic that happens, they're able to get the supports that they need in an emergency situation. So if a call is placed and a senior does not respond, aid is sent to that senior's home to just as a welfare check. So I think it eliminates some of the worries for family members who don't live in the same area as their aging family member, and really just alleviates some of that stress. So our local MAP offices are all throughout the state of Maryland. We have 19 local area AAAs, and their information, we have 23 local area offices partnered between our 19 area AAAs. So their information is placed on the screen. And again, it is by county. So if any of these counties stand out to you, it would be the number for your particular area AAA. So connect with MAP. It's not just a hotline. It's a personalized service. Whether someone is planning for the future or facing an urgent need, MAP provides compassionate and knowledgeable support. Services are provided online, over the phone, as well as in person in our MAP offices. You can also get a service where a MAP counselor can come to your home to provide counseling and access to resources if you're unable to come into that local MAP office. We also have a really great partnership with 211, where folks are able to call 211 to access information as well as to get connected to their local MAP office. So again, please utilize this particular phone number. And I want to thank you for taking the time to listen to my spiel. My information is on the screen. If anyone has a particular question, please reach out to me via email. And you can also follow the Maryland Department of Aging on all social media platforms, Facebook, Instagram, Twitter, YouTube, as well as LinkedIn. You can also learn more about our Longevity Ready Maryland program, our 10-year plan of how we will support Maryland's aging society. That QR code is on the screen, and you can also go to lrm.maryland.gov to learn more information directly. So now I'm going to open it up for questions. And one thing in addition, my manager, Amanda DeStefano, is in the audience and will be assisting with questions. So I may pan to Amanda if a question comes up and I need some support.
Thank you, Renee. I'm looking in the chat now to see if we have any questions. We do not at this time, but I want to take a few moments to allow everyone to digest all the information that you just shared that was so incredibly informative and helpful. And we have the time to be able to answer questions today. And so I open it up to everyone to do so.
Good afternoon. My name is Cedric. I am here on behalf of Bright Star Care of Howard County and Anne Arundel County. I was just wondering if there was a physical location where we would be able to stop by and drop off, some contact information or brochures or something.
That's a great question.
You said of Howard County.
Yep. So I service Howard County, Anne Arundel County, Easton, and Salisbury.
So you are asking to be able to drop off information to those direct map offices?
Correct.
Okay, so yes, they do have physical offices. If you put your information in the chat, I can certainly connect you to the map coordinators to make sure you can get that information to them. Or if you would like, we love visitors at our new MDOA office, which is on 36 South Charles Street. So if you would like to drop them off with us, you can certainly do so as well.
Okay, thank you. I'll put my info in the chat as well. Okay, I appreciate that.
Thank you very much.
Thanks, Cedric. That was a great question.
Thank you.
You're welcome.
So I have a question. This is Billy Baker Norris, and I'm with Care Patrol of Central Maryland and Loudoun, Virginia. Care Patrol is a nationwide referral resource for seniors. We also specialize in placement, of course, for assisted living and memory care.
Mhm.
And I'm just curious, for the waiver communities out in our specific area, I'm thinking, and I'm please help me if I'm misspeaking. I don't think we have a waiver community available to us. Is that like an application process? If we had a smaller assisted living that wanted to apply, is that something that would be done with the MAP program, or is that done through the Department of Aging? Just for some of our lower income families, it's tough for them because they are at odds. And when they hear that their only option really is a nursing home, it's difficult for families. So I'm just trying to, figure out ways how we can work as a community and help those folks to understand. That's my first question. My second question is, what we typically do in our office is we send our MAP coordinator an email with a background of the client that we're working with. Do you have a streamlined referral form that you would like us to use, or is there something that you could share with us that would be more specific to what your needs are to help them a little bit? I don't want to say quicker because our office here in Frederick County is amazing, but just if there's something that I could share with the Care Patrol offices to say, hey, look, this was an excellent webinar, but this is the key information that they need to be able to help families.
Thank you so much for those questions. So Amanda, please feel free to jump in. I'll start with your first question regarding the community options waiver registry and folks who would like to stay within the community instead of being placed in a nursing home or skilled facility. I think for MDOA, we find it very important to have our seniors stay within the community. So being able to provide resources and opportunities and services so folks are able to stay within the community would be the option that we would, that low-hanging fruit that we would go towards first. Having folks connect with MAP to see what services they would be able to qualify for in order to stay within the community would be very important. I think that would be the first step in connecting folks to a MAP counselor to see what options for that they would be able to access first. Amanda, anything else to add for the first waiver question?
Yeah, I think that, and clarify the question if I've interpreted it incorrectly. It sounds like you're interested also in learning about how smaller group homes or smaller assisted livings can become waiver certified. That is something that is outside of our AAA, our Area Agency on Aging's purview, and it doesn't happen here at the Maryland Department of Aging either. It happens in tandem with Maryland Department of Health and the Office of Healthcare Quality. I would be happy to put you in contact with the right folks who can help any assisted living that you're talking about sort of get that designation as a waiver facility and can serve individuals. Smaller assisted livings can be paid for, or the cost of those be offset by community options waiver. Additionally, here in the state of Maryland, we currently have a program that is called Senior Assisted Living Group Home Subsidy, and that particular program also works with smaller assisted living facilities in the local jurisdiction. So each of our AAAs work with smaller assisted living facilities who are willing to participate in our program to offer a subsidy to individuals who are interested in seeking assisted living placement and aren't able to afford the full cost of care. Typically those, like I said, those assisted livings are a much smaller setting, no more than like 8 to 10 individuals, and that's probably even pretty high on the census number. And ultimately, the intention of that program is to hopefully transition individuals from the Senior Assisted Living Group Home Subsidy, which is a state-funded program, to seamlessly to community options waiver when the time comes. So we try to pair those with waiver certified placements so that individuals do not have to move when they become eligible for community options. So in order to access the Senior Assisted Living Subsidy Program, that is something that you would start with Maryland Access Point. They're going to do some initial intake and assessment. They'll do that level 1 screen that Renee referenced that really kind of helps them better understand the needs of individuals, and then add them to a wait list or help them get access to the program if there isn't currently a wait list. That does vary from jurisdiction to jurisdiction. So I hope that better addresses your first question. Renee, I'm going to punt it back to you for the second question related to the standard referral process.
Yes, and again, if you want to jump in for the standard referral process. So I believe the question is you're asking if there is a standard document or form that you can utilize to send clients directly to your contact at your local AAA. And I believe that is something that we are working on crafting. And I think, Amanda, you jump in whenever you feel the need to. That is something that we are working on crafting so we can streamline for our AAAs. And making it a standard document that we can use for future practice. So that is something that we are working on, but we don't as yet have it to release.
Yeah, that's correct. Each of our area agencies on aging run Maryland Access Point slightly differently. So if you've seen one map, you've seen one map. So if you're serving in multiple jurisdictions, while I think it would be fabulous to have one standard referral form that could potentially come to the Department of Aging and be piecemealed out to the AAA network, we don't have anything like that currently. If you're not sure who the contact is at your local area agency on aging, or not successfully connecting, utilizing the phone number for the local area agency on aging to the MAP office and need assistance, feel free to reach out to us. So Renee and I are both resources that are happy to help you facilitate relationships and connections at those local MAP offices and area agency on aging offices so that you can better assist the individuals that you're serving. We're always happy to receive information from you that we can share with the AAAs regarding a specific client or maybe a batch of clients that you're maybe working with. So don't ever hesitate to reach out. We're always here to help.
Absolutely. And again, I did put my information on the screen for those who do have additional questions or concerns and would like to reach out.
Renee, we do have one more question. It is from Linda Perry, who had asked, could you provide me with the address on Charles Street again? She is from Baltimore and would like to drop off information as well.
Okay. 36 South Charles Street. Amanda, I'm not able to text that in the chat. If you're
I'll
able
take care
to,
of it.
that
I
would be
am.
super
Yep.
helpful.
I do also have an additional question. This is Linda Perry.
Hi, Linda. Thanks for joining us and thanks for your question.
So thank you for that. And I'll be seeing you in person, Renee.
Yeah.
So my additional question, because I didn't know about this, was the durable medical equipment reuse, because I have clients that definitely need that. If you could give me a quick walkthrough of how do I get someone in that so they could get these supplies, as well as is there any cost involved or anything like that, or eligibility?
So it is the equipment is free. How you would access that would be first step through MAP. So what county are you in?
Baltimore City.
So Baltimore City, you would call the Baltimore City MAP office,
Okay.
and then letting them know the particular service that you were looking for, and they can walk you through all the steps in order to get to access those services.
Okay, the majority of the clients that we service are in the waiver program. So they're already in CFC or CPAS. And so does that kind of qualify them a little bit, maybe, in the name of Jesus?
So the nice thing, I'm going to jump in. Sorry, Renee. So the nice thing about the durable medical equipment program, it's a free in, free out program. So everything that is received through that program has been donated. It's been sanitized, restored to like new condition. A lot of the information, or a lot of the equipment that we take in is new and has never been used. It's overstock and things of that nature that have been donated to us, and we put it back in the hands of individuals who need it most. It is available to anyone, regardless of age, injury, disability, income.
Wonderful.
It's a free service. So individuals who need durable medical equipment can reach out directly, while you can absolutely start with MAP and then also learn about all the other really wonderful program services and supports that are available. If you already have a supports planner, or you're already part of waiver services, or you're well connected in others and just need help with, as an example, a rollating walker, you can also reach out directly to Durable Medical Equipment Reuse Program. In just a moment, I'll put the link to our website where you can find out more information about the program. And there are 2 online submission forms that you can complete to request equipment. And then someone from our department who works in the DME program will reach out to you directly, help match the individual to the appropriate equipment for them, and arrange for pickup. Pickup can happen all over our state. So the warehouse where all of the equipment is housed is centrally located in the center of Maryland. However, we have satellite locations that distribute the equipment all over the state. So through a coordinated effort, the equipment comes from our main DME warehouse to, out in Allegheny County, Garrett County, Washington County, and all the way to the Eastern Shore. So people don't have to come to Central Maryland to get access to the equipment either. While our department does not have the capability, though, to deliver to homes and set up, that would be something that would have to be organized. Organized or arranged through the Maryland Access Point, and not every MAP office can offer that as well. So sometimes getting equipment from the distribution warehouse to the individual's residence can be a bit of a challenge that we're still working through. So, but as Renee said, you can access all kinds of durable medical equipment through that program. There's 2 categories. One is a more simplistic DME, and the other one is a much more complex DME. So things like shower chairs and shower benches and a standard walker, those kinds of things are simple DME, and more complex DME might be your power wheelchairs or Hoyer lifts or things of that nature. But there are hospital beds and
Awesome.
all kinds of cool stuff. So please feel free to reach out and connect your folks that are in need
Go
of
as far as a chairlift.
Yeah.
Okay. You're speaking my love language.
I
This
know,
is,
right? It's a great program.
yeah, and it started off with free, so you got
Yeah.
me. That's in the budget. It's in the
Well,
budget.
exactly. Well, and so many times, an already stressed budget like a CFC budget or, other programs like we even internally through the AAAs sometimes pay for DME that isn't paid for or isn't available with other state funded programs. So this particular program has really done a lot of really wonderful things for our state. One, it helps us get durable medical equipment into the hands of people that need it, regardless of income. The other, and at no cost. The other piece of that is a lot of DME that would have otherwise ended up at our landfills are being diverted back into the hands of people who need them. So we take care of the sanitizing things and getting them into good working order and back out into the hands of people that need them and divert it out of landfills and ultimately impact our environment as well. So this is a really cool opportunity and a program that has gained a lot of national attention for our department.
Is that 240 number on the website a direct connection to someone for this program?
Yes. Yes,
Okay.
it is.
Okay, beautiful.
Mhm.
Beautiful, beautiful. Thank you so much.
Of course.
I know a lot of people that are going to be really happy when I show up with this.
Yay!
So at least one person gained something great from the presentation today, right?
Oh, this is great. I'm
It
loving
is.
this.
Yes. Yes.
Maryland's best kept secret is MAP and DME.
Amen.
I have one.
That's true. I mean, in our work, we refer to maps so often because they are the cornerstone of the information, and being able to, have it in all one place is a gem for families for sure.
Mm.
I have one question.
Okay.
Is this for just for aging with disabilities or for any aging population?
So any aging population.
Okay, just
And
wanted to
those
clarify.
with this and those with disabilities, you don't necessarily need to be a senior with disabilities.
Okay, just wanted to clarify because I'm based in Delaware, so I just wanted to make sure. Thank you.
Awesome, thank you.
Welcome from Delaware. That's great.
Yes, thank you.
Absolutely. Thank you, everyone. Thank you, Linda. Thank you, Billy, for asking such thoughtful questions, and Cedric as well. This has been such a fruitful conversation. We still do have some time, and I'd love to offer that up to the audience as well. Oh, as I'm talking, there's a comment in the chat. This is Tammy Taylor, a caregiver to her elderly mother. I considered myself to be pretty tuned into services available, but listening to today has opened up a lot of new information. Thank you. The bigger issue is how to get this info to more people. Yes, yes. Sharing is caring. We really believe that here at the EPN. That can be done with us individually through word of mouth, but that is why the EPN, and I speak on behalf of the EPN, was so passionate about having this webinar today that will be recorded. And so we invite you to share this recording as a way to get this information out to all your friends, family, colleagues, etc. Because we too feel the same, that MAP is the center of support and care for our aging Marylanders. And so we're aligned with you in wanting to share this information to all of us here in the state. So thank you so much for sharing that, Tammy. This is great news that this is a helpful resource to you. Oh, and another question or comment. Patricia. Hi, Patricia. I have a program for caregivers called Who Cares? I make portraits of CGs and they can be nominated for a podcast interview. Okay, so this is something she's sharing about her personal work with caregivers. And thank you for the work that you do in honoring them because, yes, as we mentioned today, we have to care for our caregivers as well. So thanks. Do we have any other questions or comments? You can pop a thumbs up if we are in a good place to wrap up. Unlike Teams, I do not see the ... here if someone is typing, so I want to be mindful and respectful if somebody's actively trying to type a question and I'm wrapping. Okay.
Kendall, I just wanted to offer too, and Renee, I'm sorry, I'm going to throw you under the bus here. Going back to Tammy's comment, we are happy to present. So if you are a part of support groups or connected to hospital systems or care planners or discharge planners who would benefit from this information, and you are serving a specific jurisdiction, each of our area agencies on aging and our MAP programs provide outreach and do programs very similar to this that are hyper local. So we can connect you to our local MAP offices for sort of a repeat act of this that provides information about the local office. Or we're always happy, when I say we're, I mean Renee, is always happy to do these types of presentations as well, because we too are trying to get the information out there. While I say we're the best kept secret, we really don't do that intentionally.
We don't want to be a secret.
You know,
Right?
yeah, we try to get the information out there, but oftentimes what we find is that people don't know that we exist until they're in a crisis mode and start, digging around on websites or, happen upon us, because they're looking for a specific resource to meet a very acute need. And what we would really love to see is people exploring the benefits and services available and creating a plan for aging, and what that will look like as their needs change, and be aware of the services before they need them. Because many of the programs and services that we reference also have sometimes a wait list, or at a minimum, an eligibility determination process. So as an example, individuals who are reaching out who, need help with financial benefits, each of those financial benefits can take 60 to 90 days to determine eligibility. So calling us when you've got that service disconnection form or a letter in the mail is almost too late. So we really want people to know about this service and understand the different benefits, services, and supports that are available to help them remain active, healthy, independent, and in the community for life.
Thank you so much, Amanda. That's so helpful. We've gotten so many comments in the chat to say this is such great information. It's much needed information. Thank you so much for sharing. Tammy popped in another comment to say that having spent much time in the hospital setting, is this information readily available to case managers, or could it be, is that something that's on the radar for MDOA and the MAP team to be able to have that at that handoff and that discharge, so those families and caregivers can walk away with that information? That's a great question and a great point, Tammy.
So yes, that is a coordination that we are doing with hospitals and skilled nursing facilities to be able to provide families with information about MAP prior to them leaving the hospital. Yes.
Thank you. We just have a few minutes left. Again, I just wanted to be able to offer that space and time with our last less than 10 minutes. And if we're good to go with all the thumbs up, I'm gonna begin to wrap up for today. I'm so glad that we've been able to have such an informative presentation and being on the receiving end. But I think having such an informative and thoughtful discussion here, again, to reiterate that sharing is caring, not only about just the information here, but sharing our experiences together is what has allowed this conversation to happen, and could have answered other questions by someone asking a question here. So thank you for the courage to be able to do that. We do have one more comment from Jasmine. Jasmine is an intake specialist with Eminence Home Care. Very informative when I'm the one who is one-on-one making that call to MAPS with clients, and to have this information helps me to be able to answer their questions. That's so great to hear, Jasmine. Early onset dementia, can this person serve them? This is a specific question that Patricia has, and this is maybe that could be something be answered more in depth outside of this chat. It's case specific about an individual with living with dementia. Could this program serve them? This being a MAP. So the answer, yes, could be yes. Thanks, Patricia. And again, I'm going to pop all the contact information that could be beneficial to you, which is our contact information at the EPN, but also Renee's contact information directly, our speaker, and then MAP as well. So if you have any specific questions that you'd like to take more time for, you are welcome to join there. And with that, I'm going to begin to wrap up. So as we wrap up today's webinar, it is important to share as an emergency preparedness network here at the EPN, while MAP is not an emergency service, as Amanda had mentioned, but as well as Renee, that MAPs plays such a vital role in preparedness by helping individuals access these essential resources that MAP offers before a crisis occurs. And that's why the EPN felt this would be so valuable to have here with our audience today. I want to extend our gratitude to Renee, who's been such an incredible speaker, for sharing valuable insights into MAP and the resources available to support all of our aging Marylanders. Your expertise is truly appreciated. And thank you to Amanda as well for tapping into the conversation today on behalf of MAP to offer your support and expertise. I also want to thank each of you in our audience for your presence and active and engaging participation. Your engagement is what makes these sessions so meaningful but impactful. So we thank you. If you have any further questions or are interested in any additional resources, please don't hesitate to reach out. My contact information at the EPN is in the chat. It's that info at mdemergencypreparednessnetwork.org. That's us at the EPN. You'll also find, again, Renee's contact information and MAP's contact information as well. And following today's presentation, you can expect to receive a PDF copy of today's slides for your review, a recording of today's webinar, and some additional supportive goodies that Matt provided to me that I'll be sending your way. So thank you so much for joining us today. We're so grateful to have you and looking forward to seeing you next time. Goodbye.
Thank you. Bye-bye.
You're so welcome. Have a great rest of your day.
Renee. Thank you, Amanda.
Thank
Thank
you.
you.
Thanks, everybody.
Thank you. Have a good day.
You as well. Thank you, thank you, thank you. Renee, if you have like a minute to hang on, I just want to say thank you. I just don't want to hi, and then that's it. And Amanda, if you have like a minute of your time, I want to be mindful.
Sure, no
You
problem.
did such a great job. Bye, everybody. Thank you. Hi, Barbara.
Hey.
Hello.